idea, you can just basically check the word cervicalgia, and then the definition will help you answer it. And you can find the codes for cervicalgia. The other one is a cervical somatic dysfunction. So all of this information, but at the end, if you will read these all, maybe your 2 minutes have already been consumed. How can you answer without understanding? That's why one technique in the exam would be going to the codes, checking the choices. Because in the exam, you may be given a lot of diagnosis and a lot of codes, but in the choices, which one correctly appears? So I will go back to the scenario. All of these highlighted phrases or sentences have a corresponding codes. It's just a matter of the question and the choices, which codes you will need to answer. So all of these codes, the pain, headache, the ICD code is G44.311. Where did it happen? When the patient fall. It was an accident fall. First time. The code is W20.8 XXA. So something like that. Are you following? Now, do you have a picture? Do you have an idea what medical coding is all about? Any questions or concern? So if you see those codes, you can check it on the book. So for example, M54.2, you can either find the code by using the name of the diagnosis, cervicalgia, or you just go directly to M54.2. That's how you use your book. And that will guide you if this choice is the one you need to select. If you see it on letter A, letter B, letter C, or letter D, then you may have the confidence to know it's the correct answer, if it makes sense.
By the way, which one correct answer there?
There's no correct answer because there's no question. But maybe the question would be, given the situation, the doctor said the diagnosis of Mrs. Finley is cervicalgia. What is the ICD-10 code for cervicalgia? So you will now be given choices. Then you need to find what is the correct code for cervicalgia. And it turns out cervicalgia is M54.2. At the later part of the slides, I will give an example of a practice test and how you will answer. So let's just finish this. So this for CPT codes, you don't use letters. You only use numbers. It can be a 5-digit code. So CPT all about procedures, operations. And it is broken down depending on the category. General anesthesia, anesthesia from 0 months, from 0 years to 5 years, anesthesia for 60 years old and above. You have your different surgery depending on the body organ system, laboratory and pathology, your medicines, your guidelines in admitting a patient in consultation, your laboratory panels, your complete blood count, your pneumonia test. So all of these will fall. But as I said, maybe around 60 questions you will answer using your CPT book. So you really need to be familiar with what the question is asking so you can find the correct codes. So even ambulance service, your supplies, these are now your HCPCS code, another book. Your syringe, your needles, your IV fluids, your medications. So all of it will be coded. For HCPCS, 8 or 10 questions only.
We
So
will
now
learn, right?
I'm sorry, yes?
we will learn all of this, right? And
Yes, you will learn all
share,
of this. We will
you will
start
share
at you will
materials
start at
also.
level 3. So with level 3, we will start studying ICD-10, CPT-4, and HICPICS properly on the guidelines, how to use the book, and what are the basic codes that you need to learn. So let's have a practice test. So before a practice test, do you have any questions or concerns you want to be addressed? Anyone? Okay, none. So let's proceed with the practice test. So in an exam, you may encounter short questions or narrative. So this one, it's for an ICD-10, right? It's very simple. What is the code for dandruff? Now, question, are there any other medical terms for the condition dandruff? Or you can just search dandruff. Do
What
we
is
all
this?
know what dandruff is?
What is my question? What is this dandruff?
The dandruff. Okay. Dandruff is when on your scalp, the skin is flaking. You will have, it's like a snowflakes. It's like dead skin cells. It has an itchy feeling on your head because the layers of the skin of your scalp is irritated. So you will have white patches of dry skin that can be seen falling on your folders, on your clothes. So this is a medical condition, irritation. So dandruff. So what you can do is first, check the codes. What does L30.5? So you will find the book. Then look at L30. Is that dandruff? What is L21.0? Is that dandruff? And so on and so forth. And now, if you're able to check that this code is not dandruff, then you can not consider this. Or the other way is
One.
looking for
It's
dandruff like a dictionary. You go to letter D, check if dandruff is
Seborrheic
there,
dermatitis.
and it will give you a code. So for this, the answer, if you have your code, your book, flip the pages, whatever you like, find dandruff in letter D, or check the codes. But for this, I would suggest you check dandruff. This will be your key term. And the answer for dandruff will be
it will be
L21.0.
yeah. I check in extra.
So in
You can,
sorry,
yes, for ICD-10, you
in
can Google. Can you Google it?
yeah, it's seborrheic dermatitis.
Yes, so the appropriate medical term can be seborrheic dermatitis. So as I said, it's an inflammation, irritation. But sometimes they will use layman's term, dandruff. For ICD, there's no problem because it's standard. You can practice with Google. You will just Google what is the ICD-10 code for coronavirus, for pneumonia, for TB, for dysmenorrhea, something like that. But in other
Sir,
codes, yes.
question. In taking the exam, for example, they're having this kind of questions. We are allowed to use Google or what?
No, you are not allowed to bring any gadgets. You just have to bring
Okay.
your books. And
But
a
we can bring dictionaries, medical
medical
dictionaries.
dictionaries is allowed.
Okay.
But sometimes, depending on the author of the book, they have a keywords or terminologies in the back. So sometimes some medical conditions will have definitions at the back of the book. But it's better that you bring your medical dictionary. For me, I did not bring medical dictionary because I relied on my medical knowledge. Since I think I would say I'm a bit confident that since it's just 8 to 10 questions for medical terminology, I would just guess it if I forgot it during my nursing education. But these are the types of questions that are easier to answer. As simple as this. Look for the word, just like looking for a word in dictionary, or go directly to the codes and then cross out which one is incorrect. Remember, you only have 2 minutes to answer. Now, what if the question is longer?
Patient was seen.
It's a narrative. So let's have time. I'll give you 30 seconds to read. But you need to note there's a gastrointestinal bleeding. If it says gastrointestinal bleeding, what does it mean? There's hemorrhage, there's bleeding. Now where? Where is your gastrointestinal? Is it inside your eyes? Inside your brain? Is it on your arteries or your veins? Or is it in your stomach?
In your
That's the
stomach.
question, right? That's why some basic knowledge will be helpful. Now the question, which diagnosis are we asked? Is it the gastrointestinal bleeding or the arteriovenous malformation of the small bowel? Or colonoscopy? Is the question asking for the disease, ICD-10, or for the procedure, colonoscopy, CPT-4? Do you see any CPT-4 codes here? None, because CPT codes are all numbers. This is alphanumeric. And with the header, you would know that this is an ICD-10 question. So you decide, are we going to code the gastrointestinal bleeding or the arteriovenous malformation of the small bowel? So the codes, it's confusing. Why there are 3 codes that are in the letter K and why there is a code which is letter Q. Sometimes in scenarios, this can be a distractor or the Q can be the correct answer. That's why you need to rely on the book. Let's check what is the definition of Q27.33. If you will open your book, Q27.33, it defines arteriovenous malformation of digestive system vessel. Do you think letter B is the correct answer?
Maybe.
The meaning of Q27.33 on the book, arteriovenous malformation of the digestive system. Sorry, of the digestive system vessel. You would wonder, this is the only one that is different, that stands out. It's Q versus K. For me, personally, I don't have an idea what the K categories are. Let's check K55. So you really need to be quick in opening your book and you better know your alphabets. So you should know that K, L, M, N, O, P or J supersedes K. For K55, in my book, K55.20 means, where's that? Angiodysplasia of colon. So it's not angiodysplasia. So I know that this is incorrect. I will go back to K55.21. It's your angiodysplasia again. So it's incorrect. So I would say that most probably, even if I don't check the other choices, the answer is letter B, Q27.3. Because it describes the small bowel and it's the arteriovenous malformation, which is the definition of Q27.33. That's why in your medical knowledge and in reading, you need to know. So if you have the book, highlight this, or if you're taking the exam, you can find on your textbooks. Now, how about for your for CPT4 codes? Again, it's all numeric. What are we looking for? What is the operation here? Is duodenum an operation? Duodenum is a term for a surgery? No, because duodenum is part of your intestine. So this is a body part. What is an incision? Incision means when they cut it using a surgical blade,
laceration.
a surgical knife. So this is an operation. And we all know that CPT codes are for operations and procedures. What is the type of operation? You need to identify. Operation. What is a jejunostomy means? If you do not have the idea, you can go directly to the codes. Because our goal is to pass the exam. We really don't need to be knowledgeable like a doctor, like a nurse, or medical practitioner. But reading this, we already know the idea. Our priority is get 105 correct items out of 150. So go directly to codes. What is 44120, 125, 126? Then we will find out that anastomosis of the duodenojejunum or this one, duodenojejunostomy anastomosis will be coded 44120. So we should shade on the answer sheet letter A. This is easy. Why? You only have one code. But there are questions, you will code 2, 3, a combination of ICD, the disease, and a combination of your CPT, the operation. And sometimes the length, the weight, the number of stitches, the number of specimens matters in coding. So you really need to be observant of what is written. Another one. So this one, you did an SLP therapy. What does SLP therapy is? So this is a speech language therapy. Why? Because the 2-year-old kid is having a problem speaking because he has a cleft palate. The one where you have problems with your cleft here or your mouth, right? In your nose. So it has an effect on the way you speak. So after surgery, which is your surgery, you had a repair of cleft palate. Is that the procedure the question is asking for? The cleft palate repair? Or is it the SLP therapy? Which one do you think the CPT code is asking for? Is it the cleft palate repair for your mouth? Or the SLP, the speech and language therapy? So you will need to check first. So this is now for your speech intelligibility. So we are looking for the CPT code of your SLP.
So it means the
Now you would
procedure.
say, oh, these are just the same. A and B, same codes. But there's a modifier. This is what I'm talking about, the 96. So you may encounter, 2 years old. So most of the modifier deals with age and the number of items, location. Or how about what's the difference between 92507 to 92508? So you will need to check the codes. CPT codes or the procedural codes are easier to take because you don't need to find the particular code using the word. You just go directly to the codes and check